Good afternoon, members, and welcome to this afternoon's meeting of the Lincolnshire Health and Wellbeing Board. So can we start with agenda item 1, please, which is election of chairman. Could I ask for any nominations, please? Councillor Bowkett.
Thank you. I'd like to nominate Councillor Sue Woolley. She's done an excellent job over the last few years as chairman, and I'm sure she will today if she gets seconded.
Do we have a seconder for that, please? Councillor Bradwell. Are there any further nominations? Okay, so it's proposed and seconded that Councillor Sue Woolley becomes the chairman of the Lincolnshire Health and Wellbeing Board for 24-25. All those in favour, could you please raise your hand? Anyone against? Any abstentions? That's carried then. If you'd like to come and take your seat, Chairman.
I have red button. Thank you. Good afternoon, everyone, and thank you, first of all, for your confidence. It's much appreciated. Can we move swiftly on then to the election of the vice chairman? I would like to propose John Turner. Can I have a seconder? Thank you, Councillor Bowkett. Are there any other nominations? In that case, can you raise your hands if you're in agreement? Anybody disagree? Any abstentions? Right, thank you. Mr. Turner, would you like to come and join me? Before we move any further, this is the last meeting of Katrina, who is going to retire to do her garden, amongst other things, and walk the dogs as well, so I understand. Katrina has very nearly been with us right from the start of Health and Wellbeing Boards, haven't you? Yes. Yes, so she's been at it a long time. Devil for punishment, I think you might say. I'm sure I can speak on behalf of you all in saying thank you, Katrina. We've been in a safe pair of hands and it's much appreciated. And I hope you enjoy your retirement. Thank you. And next victim is Rachel, who is down here. So we've got her into Katrina's job role. But seriously, for a moment, if there's anything that you need to make us aware of, or indeed want bringing to the attention of the Health and Wellbeing Board, then if you'd like to get in touch with Rachel, and she will help you out as best she can. Thank you. Let's move on to item number 3, which are the apologies for absence. Please, Katrina.
Thank you, Chairman. Right, we've received apologies for absence from Councillor Gray. We have Councillor Sneath here as his replacement, Councillor Marfleet, Councillor Rawlins, Kevin Lockyer, but we have Di Bailey here as his replacement. And we've also had apologies from Professor Neil Juster. Thank you, Chairman.
Thank you. We'll now move on to item. You don't need those accepting, or do you? No. Okay. Declarations of members' interests. Are there any members here who would like to declare an interest at all in any of the papers? If you find that when we do get to any papers, you suddenly realise you need to declare, please indicate, and I'll make sure it's noted. Item 5, minutes of the Health and Wellbeing Board meeting held on the 12th of March. This is to confirm the minutes of the meeting held then and make sure it's a correct record. Is there a proposer, please? Thank you, Councillor Bowkett. Is there a seconder? Anyone else that was here? Thank you, John. Okay. All those in favour, please raise your hands. Any against? Any abstentions? Thank you. Item 6, action updates, and that's to note the action updates as circulated on pages 15 and 16 of the agenda pack. If you all agree, can you raise your hands, please? Thank you. We now move on to the chairman's announcements. I'd like to welcome everybody here today to our board meeting, and that's everyone here in the council chamber and to anyone who may be listening online. Before we begin, for those of us in the council chamber, there is no fire drill planned this afternoon. In the event of a fire or the alarm sounding, we need to leave the council chamber through the rear doors. That way. Either way, it doesn't matter, just get out. Through reception and assemble in the car park at the front of the building and await further instructions. Can I please remind everyone to ensure their mobile devices are switched off or at least on silent, and when I ask you, invite you to speak, then please ensure that your microphone is switched on, and that little red indicator there will tell you. If you wish to ask a question during the course of the meeting, can you please raise your hand, and my Vice Chairman will make a note of those who wish to speak. Can I ask you to, if you agree, the Chairman's update as circulated? Please, by raising your hands, please. Thank you. Anybody against? Any abstentions? Thank you. Right, we move on to item 8, which is one of the first main items. This item was circulated as part of the agenda pack. This item asks the board to review its governance arrangements, reaffirm its terms of reference, and approve associate membership of the board for 24-25. I'm going to ask Alison Christie if she would present the report and then invite questions from the board. Thank you, Alison.
Thank you. Yes, we're required annually to review the terms of reference and the governance for the Health and Wellbeing Board. So the terms of reference are attached as Appendix A. There have been no changes in terms of statutory responsibilities or changes in terms of the role of the board. So they are as written in the terms of reference. The one action that we do need to just do is to agree the associate membership for the coming year, which under point 5.4 we're required to do annually. So that's on page 26 of your agenda pack. So really it's just to reaffirm our terms of reference and agree the associate membership.
Thank you, Alison. Okay, are there any questions? Councillor Nanstead.
Thank you. It's not the question you may be anticipating, but is it possible in the future to look at adding a second representative from the voluntary and community sector, in addition to how it is now? The districts did note that there's a representative from the LEP, and that if the devolution ever happens, the LEP won't be here. And wondered if that's a possibility of taking that place. So we ask that it be considered, because obviously the voluntary sector does cover really wide cross-section of different groups, and we think it would benefit the board to have a second representative.
Thank you, Councillor Nanstead. Yes, we'll certainly take it away and consider it. Emma, behind you, represents all of the voluntary agencies, and it's no mean task, I have to admit, because obviously the structure's so broad. But probably in a conversation with you, Emma, then we can certainly walk through and consider that. Yes? Okay. Thank you. And it wasn't the question that I thought you were going to ask either. Anyone else? Okay, thank you. Can we therefore look at the what we're required to do, which is to endorse the terms of reference and the governance documents attached at Appendix A and agree the associate membership on the Health and Wellbeing Board for 24-25. Can you raise your hands if you agree? Anyone disagree? Any abstentions? Thank you. That is carried. We now move on to item 8B, which is the Lincolnshire Better Care Fund update. This item was circulated as part of the agenda pack on pages 33 to 36. The item asks the board to review the BCF for 23-24 as the end of year report and the BCF 24-25 planning submission. I'm going to invite Martin Samuels, the Executive Director of Adult Social Care and Community Wellbeing, to present the report and then invite questions from the board. Thank you, Martin.
Okay, thank you, Chair. So, as members of the board will be well aware, that the Better Care Fund has been a friend of ours for a number of years. It's one of the key ways in which the Department for Health and Social Care gets local authorities and the NHS to work together through a set of funding streams. Unfortunately, the timings under which the Better Care Fund operates nationally tend not to fit very well with the timings of these boards. So although the submissions that we make regularly are required to be signed off by health and wellbeing boards, it rarely works for us to be able to do that in advance. And so our latest position is a classic of that. So the deadline for submission for the updated plan for the current year was in fact yesterday. So in consultation with yourself, we have made that submission, but you have the board has the plan here. There's no significant changes from the 2-year plan that we submitted last year. So we've provided an end-of-year report for the year that's just finished, 23-24, and a revised submission for the year that has recently started. I think one thing that I would flag is that we are now trying to get ahead of the game, working across the system to get a clear sense of what is it that we as partners would want to achieve for the people of Lincolnshire for the next financial year, for 25-26, so that we can have a clear sense of what the priorities and the pressures within Lincolnshire would be, how we would want to work together to achieve that, on the basis that the odds are that whoever is in government after the next general election will want to look at the Better Care Fund and see, to review and see whether it works in the way that they would wish it to. And it would be beneficial to us to have been really clear what it is that would be best for Lincolnshire, so that we can both feed into that review should we get the opportunity, but also that we have a clear sense of what the local priorities are, so that when we do get the national planning guidance for whatever it is that goes forward in the future, that we are well placed to say, well, this is what we need to do for Lincolnshire. We can make the national scheme work for Lincolnshire, rather than us following the national scheme and trying to somehow adjust it for our purposes. So that work has already started and will take us through into the autumn. With the timing of the election, I think it probably does mean that the government, I say whoever is in government, will have had time to review the Better Care Fund in time for the planning guidance for 25-6. I think we're actually in a better position than we might otherwise have been. I have the team who've actually done all the work on the Better Care Fund submission here, so they'll be able to answer any questions that might come up.
Thank you, Martin. And I completely agree with you about the timing. It's not our fault if there's fault to be apportioned, but it is frustrating that we can't actually bring the information and sign it off at the board before we have to get it in, but completely accept that that's out of our hands. But maybe 1 year we'll be in a better place. Any questions from anyone on either last year's performance or indeed next year's proposal? I think, yes, John.
Thank you. Not a question as such, but in many ways I think this could be perfect timing because we have committed to undertaking a review, which, as Martin's just described, will be happening in the months ahead. Our BCF and our arrangements, I think, have worked well over the past number of years, but it's absolutely right. They have a really focused review, a bit root and branchish, certainly of some of the priority areas to explore how we can evolve and develop our joint arrangements better, and that's happening as a partnership effort between the NHS and county council colleagues and other partners. And by the time we have completed that, we'll know where we want to take matters, as Martin's described. There may or may not be some clarity on nationally, but if we know what we want and how we want to evolve our joint arrangements in Lincolnshire, then we're in a stronger position rather than just trying to fit into whatever the new national template is or isn't. So I think we can sort of turn this into a bit of an ace for us. The timing of these submissions never quite fit, does it? But I think we can sort of get ahead of this one going forward now, I'd say. Thank you.
Councillor Bradwell.
Yeah, well, mine's not going to be such high level conversation. Mine's a bit lower. But I just want to ask about, obviously, the Better Care Fund, a lot of it goes on older people and adults. And I was just wondering, some of our young people who have profound disabilities, very often, you know, parents can't afford the super duper light wheelchairs and that. And I just wondered, you know, could some, you know, I don't know, small amount of money be allocated to something like that? Because actually, you know, these young people, they want to do the same as their peers, but obviously can't. But actually, if they have the lighter equipment and that, we all see them on telly, don't they? They move around at speed, playing basketball or something. But if you've got a heavy, older-fashioned one, and I just wonder, is there something that we could do from this fund? Now, you might say no, but I'm asking. Because I just do feel for these young people. You see them try to go to mainstream school and be part of it, and very often they can't be part of the fun.
I completely concur with the point you're making. I'll seek advice from Heather and Martin, but I don't see why we want to explore that issue together and see if we can take that anywhere.
Martin.
So as it's possible that you're aware, from the beginning of April this year, we've entered a new arrangement where wheelchairs is obviously an NHS service, but it has strong connections with the wider community equipment service. And from April of this year, we've moved into a new arrangement where we've got a new provider of the wheelchair service, which is NRS, which is the same provider as provides our community equipment service. And because it's the same provider and the county council runs the contract for the community equipment service, it's been agreed between ourselves that the county council will also therefore manage the contract with NRS for the wheelchair service. So we now have a single integrated contract that covers both wheelchairs and wider community equipment. That gives us both the scale and the leverage that we can work with NRS, and we can work with NHS colleagues in terms of the specification of making sure that the needs of young people, in this particular instance, the needs of young people drive what the equipment that is supplied. I think it's worth noting that in that transition process from the previous provider to NRS, we've uncovered that there were a number of areas in the previous service that weren't working as well as they should have done. We are confident that NRS are already providing a better service. So long as we can get the specification right, and I say because it's an NHS service, we need to work with colleagues at the ICB about exactly that. But I think the principle that we now have a really good supplier that is doing really good assessments and are quickly getting the equipment provided to people, I think that should improve the situation. And then we can have the conversations about exactly what sort of standard of wheelchair would be considered appropriate. And that, I say, those are medical decisions, so we'd need to be guided by the ICB. But we can certainly work through and make sure that happens, to that extent.
Thank you, Martin. And just for information, it does sit under this item, but last week I was with NHS colleagues. We've been part of a 2-year programme, and it was our last session last week. And I was showing John the photograph of the great and the good, or otherwise, as you might say. But interesting, we had, for those of you who might know, Matthew Taylor, who is the NHS Confed chief exec or CEO or whatever, he came along to have that conversation. And I should say that this includes Patricia Hewitt in this group as well. So you would like to think that they've got fingers very much on the pulse. One of the comments that was made more than once and agreed on more than once was along the lines of, don't chuck the baby out with the bathwater. There are things that are beginning to work really quite well from that point of view of health and social care, sharing things. But most importantly, do not accept that one size fits all, that, as I've said in the past, we can get the outcomes, but you have to allow us to get there in our own way of doing things. So I'm really hopeful that we won't have too much of a change from that point of view with the new government coming in. Okay, thank you. Anyone else? Nope. Okay, if we move to the recommendation or the action required to review the 23-24 BCF and then to note the planning of the 24-25 submission. All those in favour, please raise your hands. Anyone against? Any abstentions? Thank you, that's carried. Moving on to item 9A. This item on unpaid carers was circulated as part of the agenda pages 37 to 42. The item provides the board with an update on the carers priority. I'm going to invite Councillor Sneath, who's chairman of the Carers Delivery Group, and Anne-Marie Scott, Assistant Director of Prevention and Early Intervention, to just bring us this paper forward. Thank you. Councillor Sneath.
Thank you, Chairman. Good afternoon, everyone. I'm delighted to introduce this report on the valuable work we are doing for the Carers Steering Group. For example, I've just come from a staff carer roadshow where we've been talking to some of the many LCC officers who combine work with caring responsibilities. As you will have seen from the papers, there are over 70,000 unpaid carers in Lincolnshire who we are now looking to help and support with advice, mainly. I will now pass on to Anne-Marie to present the report to you all. Thank you very much.
Thank you, Councillor Lee. Thank you, Chairman. So, as Councillor Sneath has said, it's very timely. This week is Carers Week. We've got a number of events on both LCC and partners, and for our wider unpaid carers across this week, that recognises this year's national theme of putting carers on the map. So please do have a look at those. They are open to both carers and wider as well. So please encourage you to join those. So just to remind everybody, an unpaid carer is someone who provides unpaid help to a friend or a family member who needs support. That might be because of illness, age, disability, or mental health or other condition. And as Councillor Sneath has said, we know there are around 70,000 unpaid carers across Lincolnshire. They make up a valuable contribution to society, and we know that their value in terms of labour is around £2 billion a year. So that really does make it vital in ensuring effective support to unpaid carers and preventing carer breakdown and escalation into formal care provision. So this report provides a summary of the recent work of the Carers Delivery Group, and it highlights a number of system achievements and progress over the last year. Some of those include strengthening support and recognition for carers in the hospital environment and increasing awareness and identification carers within GP surgeries, all part of our aim of ensuring that we can recognise carers at the earliest opportunity to provide support to them. So in terms of the Lincolnshire Carers Service, as most of you are aware, LCC commissions that service. It's open to all carers with a support need. For most people, this is met through a universal offer, which is a strengths-based approach, placing carers at the heart of the process to help them identify their own skills and the support available to them in their community. The service itself receives high satisfaction scores from carers, both for feeling listened to and for feeling their wellbeing is prioritised and feeling much more informed. We've also had recent positive feedback from a user of the service, which led to an article in a local publication, Discovering Born. Additional work this year has been around obtaining funding from the DHSC Accelerating Reform Fund. That's enabling us to deliver 3 projects which have been developed with ICS colleagues and deliver against DHSC priorities. These are detailed in the report and they also link into the wider Carers Delivery Plan objectives. Other work this year has related to the biannual survey, which all local authorities with social care responsibilities are expected to undertake. This is a predefined survey with a selection formula which is also determined centrally. The purpose of the survey is to understand whether services are helping carers in their role, their life outside of caring, and their perception of the services provided to the person they care for. The national results for this year are not expected until later in the year. However, initial results from the survey are detailed in the report. Interestingly, we are now seeing the largest proportion of carers in Lincolnshire are retired, and many are spending over 100 hours or more a week in their caring role. The information in the survey will help us to develop and adapt our services to meet these changing needs, and we've now established a working group to consider the opportunities arising from that survey, and they will be further considered by the delivery group. Finally, we have a range of co-production opportunities underway with carers. One of those currently includes the administration process relating to carers' personal budgets. As we all know, carers are a hugely diverse group, both in terms of who they are and the people that they care for. And personal budgets are an important tool in assisting carers with needs that cannot be met in other ways. So this again is important in helping them maintain their caring role and preventing carer breakdown. The amount a carer may receive depends on the needs assessment, but it allows carers flexibility to address various needs. So that could include leisure activities, education and training, and improving their own care or well-being, for example. I'm happy to take any questions on the report. Thank you, Chairman.
Thank you, Anne-Marie. Councillor Bowkett.
Thank you, and thank you both for the report. It gave me great pleasure today to open the carers for our workers here in County Council, and it's amazing how many carers we do have within the County Council. You know, it amazes me every time. And the providers there giving help and support to them is really needed. We've got 70,391 unpaid carers, it says, but it doesn't mention our young carers. And I just wanted to mention those because there's an enormous amount of young people out there who are actually doing care for their parents as well, which we need to recognise as well. It's not always the older person, but it is a really good thing. People do need support when they're caring, when they've had somebody 24 hours a day, day in, day out, and don't see anybody. I think this is a fantastic service, and well done to all.
Thank you, Councillor Bowkett. Councillor Nanstadt.
Thank you for the report. The question I've been asked to ask is, could the districts be given details of the membership and a bit more detail on the projects which are in this report, which could perhaps be fed back to Councillor Wright, who is the representative, because he was the one who asked.
I don't see any reason why not, if Councillor Sneath, as the chair of the delivery group, is happy.
I can't say for what reason. He asked, and we agreed that. I don't think there's any harm in the districts knowing who's on the group and more about the projects.
I don't think the information is confidential. I think it's all there, but I just think it's a very strange question to ask. And when I see Councillor Wright, I will be asking him the reason why.
Any other questions from anyone? John.
Thank you, Sue. Thank you very much for the report. I might not have quite sort of discerned from the information, so just forgive me if I haven't picked it up correctly, Anne-Marie. Which firstly is we've got 70,000 carers out there across our county. That's almost 1 in 10 of our population, isn't it? Which is massive. Just get your head around that. And we've got really good satisfaction rates for the carers service. What I'm not clear about is how many of those 70,000 access the carers service, because if it's a really great service that carers are saying really helps them, listens to them, recognises their role and their needs, then presumably we have an ambition to have 70,000 people being in contact with that service to receive it. And then there's a sort of broader point. I'm thinking, Derek, about your DPH report around the ageing population in Lincolnshire, and how some parts of Lincolnshire were older than average as a population and were getting older quicker than average as well. So this is only going to grow as a challenge for us, isn't it, in the county, in terms of how we support carers. I agree with Wendy's point about young carers. I suppose I've particularly got in mind just the anticipated sort of acceleration in older population in the county. So there's just something about what our ambition is going forward and how we're thinking about planning and evolving our strategy and our ambition to try and keep up with that sort of growing demand, I guess. Thank you, Sue.
Yeah, of course. Good question. It really should have been in the report, shouldn't it? So apologies for that. So the Lincolnshire Carer Service sees around 9,000 to 10,000 adult carers coming through per year. Now, the premise of the service is based on a universal offer, and much of that is around providing information that carers can utilise themselves, and then they come into the service for a discussion if they've been unable to find the help and support that they need, either in their community or from the information that we provide. So we're not aiming to reach and directly support 70,000 carers, but we do want as many carers as possible to be aware of the support that is available, so that they can access it at a time that they need to. But mainly we're finding that of those that come, they find the information from the universal officer, and those that go on for a formal assessment are really quite a small proportion of those carers. In terms of the ageing population, the data that we've just had from the latest survey, where we're seeing that more and more carers that are caring are retired, that is definitely something we need to look to adapt. And whilst it's important that we support carers into employment opportunities, I think it's also important that we don't lose sight of carers are getting older. So what opportunities might we also want to focus on people who are retired, volunteering opportunities and elsewhere, but also, of course, in the case that they're getting older, the people they care for are getting older as well. So there's the broader impacts around that cohort if they come to the point when they are no longer able to support and care. And one of the pieces of work we have under the accelerated reform funding money that we've been granted is around how we support people at a point where they are no longer able to care, particularly in cohorts such as learning disabilities, where we know that we've got some older carers who are caring for their children who are now adults. So that is part of that work that we are now progressing.
Heather.
Thank you, thank you. So in terms of young carers, just to kind of give a little bit of an update about that. So we have a young carers service and we work with our schools across the county, and our schools do a huge amount of work in identifying young carers and supporting them as well. And a lot of that support is really subtle. It's about extra time with an adult in school. It's about time to talk about the caring responsibility. It's about time to talk with someone else who has a similar caring responsibility, so you don't feel like you're the only one. And sometimes it's more significant than that, and it's a breakaway, and it's time out. So we have a range of approaches for young carers. In addition to that, we're currently doing a review within the council of our young carers service, and we're going out with a questionnaire next week just to get some feedback and look at where's it working well, what might we want to do to go even further. So that's a little update in terms of the young carers. And John, if you're going to ask me for the numbers, I was frantically searching to try and get them before you asked. We have got them, and we have got a report on them which I can share, but I haven't got them right to hand at the moment. But I had another question, Anne-Marie, if that's okay. Mine's about how do we reach the people who are carers and don't realise they're carers? So I'm thinking about the people who are caring for somebody who's got substance misuse and, you know, don't recognise themselves as a carer in the typical description of a carer.
Yeah, I do. That is a challenge, Heather. We have a range of commission services, so substance misuse is a commission service. They are aware of the carer service, and we work hard to make sure our commission services link together and are aware of the other services around them. Some of the work we've done recently as well has been raising awareness with GPs, recognising that someone will often be accompanied by the carer, and taking that opportunity as well to make them aware. But it is a constant challenge. We do know that a lot of carers don't consider themselves a carer until it becomes the point of breakdown, and we want to make sure that even if they don't need to use the service at that point, they know where to come when they do.
Thank you. Lucy.
Thank you. And just to add briefly on the substance misuse carer support as well, we do have a specialist substance misuse family support service, and they do quite a lot of work to kind of directly into communities to raise awareness, and also work really closely with the specialist treatment provider to support, again, with raising awareness amongst kind of family and friends of the support that is available. That's, again, kind of universal open access. So.
Emma.
Thank you. If I could just make a really quick point, just to make sure we've got some connections. We heavily supported, working with public health colleagues, Carers Active April, so engage the physical activity sector in providing a whole range of opportunities for carers to be active. And of course, there's something about them being able to get out, meet other people, go for health walks, etc. So I just want to make sure that we're connecting in, and that when we're promoting campaigns, we're kind of all coordinating and coalescing around shared campaigns. So it would be really good to make sure that we've got those connections in. Thank you.
Yeah, we certainly are, and the steering group, I think, received a presentation about that that project. So yes, definitely there. Thank you.
I suppose the question that I would like to ask, and it's sort of almost been raised around the people not realising that they're carers. So often it seems, and it's a bit like when people get themselves into a crisis situation, if there's a carer and somebody being supported, they last for so long, but often it ends with the carer perhaps not being able to cope as well as they should have done. Is there any way that we can, either through GPs or whatever, if we know that somebody receiving support, that we can ask after, are you being cared for? Because it just feels as though, I've had a case recently where I did say, you're a carer, have you been offered support? No, I don't know. Are you sure you've been offered support? And I think sometimes people probably have, but in the moment they forget about it, or indeed that question is not repeated often enough. And then, of course, we hit a situation where we are in crisis. So Is there anything, I know you can, I mean, all the wonderful organisations down in Committee Room 1 today is a great example, but is there anything more that we can do to get the public to be more aware of the support that's there for carers?
I think we'll take every opportunity we can to raise awareness of that service. We had something in the Bourne magazine lately that's gone out in the county news and other publications, so we'll take every opportunity that we can to do that. And just to assure you, if someone has been to the carer service and they've decided that at that time it's not for them, they can return at any time. They will also receive a 12-month review, a call to see if, a check-in, to see if they're okay, do they need help again or have things changed for them. So once they're in the service, it's not a one opportunity and there will be a check back with them, but we'll certainly work with our comms team on a communications plan to proactively do as much as we can.
Thank you. Any more questions? John?
I feel we could have quite an in-depth conversation about this. It's a great subject and it's really, really important, isn't it, for health and care in the county as a whole. You were right, Heather, about the numbers, by the way, but I'll look forward to seeing that note in due course. I might just be again looking at this through the wrong lens a little bit. It's great that up to 10,000 carers have accessed support through the carers service. That tells me that 60,000 haven't. And that just feels like that's quite a big space, really. So again, if I'm misinterpreting things, then please put me right. And I'm thinking that many of these people will be visiting their general practice on a regular basis. Many may be in contact with our mental health services, our community health services, our community hospitals, our acute hospital services. And it's just left me with a feeling of other colleagues who are working on the steering group from the NHS, leaning in and supporting and exploring every opportunity that they have, as well as collectively we have, to try and promote and support the service. We have some classics in the NHS, of course, where you have, say, an elderly couple and one's caring for the other. The one who's a carer has a health issue, and that actually means that they both become immediately dependent on the health service as well. And there's also something, think about Emma's comment as well, about are we really stretching into the area of how we can ensure that both the carer and the caree, if that's a word, are being given every opportunity to look after their own physical and mental health, stay active, stay connected to the community, and all of those sorts of things. And again, sorry if I'm asking two broad questions. I don't understand how it works, but it feels to me this is so important to us collectively.
I could see that Councillor Bowkett was quite keen to respond.
As having a caring role in our family at the moment, most people know that our dad is 92 going on 93 and is our main carer from our mum. He's been offered the carers service, but he doesn't want it, and I think that's what we have to accept out there. A lot of people are carers that don't want this, but that's not to say that we haven't used the offers that the carers service provides. It's like I've been today. There's the memory service in there from the NHS. We are involved in that. They are regularly visiting mum. There's different things. Today I've looked at the online things that you can get, the apps that you can keep in touch with. We're now getting involved with that so that we can regularly keep in touch. So I think, yes, we have got 10,000 carers signed up, and there is another 60,000 out there. But I think is why it is important for our GPs, for our district nurses, and for everyone else that's out there, our care providers that Melanie is involved with, that they do have and talk to each other. Last Friday, Melanie and her team talked to the GPs and district nurses about our mum. and they all got round the table and they were talking about how they can help her. So it's not just about the carers service. It is there if you need it, but it is also about all the services working together with the carers service to provide that help, so when you are falling over, there is someone there to pick you up.
Councillor Sneath.
Thank you. Thank you. Yes, just tying together all of that, actually. I think what we're trying to get at is we just need greater awareness that there is help. For example, south of the county where I come from, we've got a lot of big employers. They don't know. They've got staff who are caring, who don't know there's help. And I think, going back to Councillor Nanestad, I think what you were meaning was you'd like to know more about this for employees at the district council, so they know they can try and access services. And I think that's perhaps what we're all getting at. We just need greater awareness for everybody. So that's something we'll be working towards, I'm sure, and everybody as well. We've all just got to spread the word. Thank you.
Malcolm.
Thanks, Chair. I'm not sure of the form, but I thought it just bears saying that I think this is a terrific piece of work. It's really made a great start. We've got evidence of a delivery plan coming through, and for a group of people in our community that are so important, both to healthcare but also to the cohesion of our communities, I think it's great that we're doing this work. Like Councillor Balke, I don't feel overly concerned about the percentage that are in contact with the service, because the service is there, and what Anne-Marie has given us is an insight into a service that is growing, a steering group that's looking at those issues. I would ask when do we see the delivery plan? I know there's always a question at the end, but I do think it is worth noting this is a terrific piece of work, and I was formerly chair of LCHS until recently, so I'm talking with that hat rather than perhaps the policey hat. But this sort of work is so important to us, and it's really great that Lincolnshire has got this sort of work on the books.
Thank you. Anything further you'd like to add, Anne-Marie?
Can I just make a comment back to John's specific question about the number of people in the service? So the survey is really helpful to us. We know that we've got this large proportion of people that spend 100 hours or more that are coming into the service. But what we know from census data is that because carers are so diverse, the larger proportion of the larger carer population are actually providing less than 14 hours a week care. And care can be anything from doing someone's shopping, supporting them with bill paying, right through to more personal care. So the level at which someone is caring will vary greatly within those 70,000 people. So some will probably never need that service. So the fact that we're saying that the people that are coming to the service are the people that are spending 100 hours or more, it's reflection of the fact that the people that do need it are coming forward. And I think that's what's important to bear in mind.
Any further questions at all? Okay, thank you. We will now move to the actions required, which is to note the paper and the progress made to date, and that we actively support the county-wide Carers Week activities. Thank you. Everyone in agreement, please raise your hands. Thank you. Anyone against? Any abstentions? Thank you. It's carried. Oh, it's you, John. This is the next paper, 9B, is the NHS Planning Guidance and Implications for Lincolnshire. This item was circulated as part of the agenda, pages 43 to 48. It provides the board with an update of the NHS planning guidance published in April 2024. And if I could invite John to now present the report and invite questions from the board. Thank you, John.
Thank you, Sue. I'll be brief. This is also me taking one for Pete Burnett as well this afternoon, as Pete wrote the report, and Pete leads all of our work on planning. So, in essence, just to share with the Health and Wellbeing Board that every year NHS England sets out its expectations of all parts of the NHS in what's called planning guidance. That usually comes out just before Christmas, actually, for us to have completed the planning process for the new financial year by the beginning of the new financial year. For a number of reasons, that's been slightly delayed this time around, but nonetheless, the planning guidance did come out, I think in March, wasn't it? And we were all at that point already well on with our own internal planning in the service in Lincolnshire. Essentially, what NHS require all ICBs to do in partnership with the NHS Trust and primary care colleagues is to aim to reach a certain number of targets. You'll be familiar with the big ones around cancer, around sort of A&E and ambulance waits, and around elective waiting. There are actually 32 that were the sort of real headline ones, and they're described in the note that Pete has done. And also, of course, we're required to be confident that we can deliver those operational target requirements within the resources that have been allocated to us. What I'm able to share with the Health and Wellbeing Board is actually we're in the very last throes of signing off our final planning submission, which Andrew, I and a few colleagues will review tomorrow. But it reflects a number of discussions that have happened in the ICB board and partner trust boards and with NHS England. So the highlight is, as you can see from the report, we're committed to delivering just about all of the 32 operational targets, and certainly all of the main ones that NHS England have set us. Alongside this, I must say we've actually worked our socks off, or colleagues have, to be in a position where we can present a financial plan to NHS England, which is a break-even financial plan. So in broad terms, the plan that NHS Lincolnshire has put forward is that we are pretty much green on all of the operational requirements, and that we're green in terms of being able to see a financial plan that is a break-even plan. I've been in Lincolnshire 8 years, and this is the first time I think we've been able to put forward a position with a sort of planned financial break-even. So that, I think, reflects the continued progress that the NHS in Lincolnshire makes or has made, and obviously reflects a lot of support and joint working with the County Council and all of our other partners represented here this afternoon. Having said that, a plan's one thing and delivering a plan is something else. Within the plan, there are some very, very significant challenges ahead. So it's good that we have an ambition and we can see a way forward to meet the plan. But within the NHS, as indeed across all of the public services and life generally, things always happen, don't they? So we know that we're still subject to industrial action by junior doctors who've called another strike at the end of the month. We don't know how long that will go on for. Colleagues will be aware that the GPs across the country are currently considering what their next steps may be in terms of their ongoing dispute with the government. We know in the past we've been subject to real pressures around winter, real pressures obviously around things like flu and COVID as well. So there's always something out there, and even if we get a clear run at that, I think it's fair to say, Andrew, we've set ourselves a pretty high bar to get over in terms of meeting the targets And also we've set ourselves a high bar in terms of getting to a recurrent balance. So there's some quite ambitious internal kind of cost efficiency type targets that we've set ourselves. But we form the view that it's right for the people of Lincolnshire that we aim to meet all of the targets that the government sets us, and it's also right for the taxpayer that we aim to do that within the significant resources that we've been given. In the round, about 1.7 billion for the NHS in Lincolnshire this year, and we crack on and roll our sleeves up and do our level best to deliver on this for the people of the county. This, of course, is not exclusively, but it's primarily the NHS's bit in terms of NHS services. The way I see this is it's really, really important, clearly, that we deliver what the NHS is tasked to do through this lens. Obviously it is. But at the same time, delivering this gives NHS colleagues, how can I put it, a greater opportunity to continue to work as constructively as we do with all of you in terms of how we improve the overall health and well-being of the population we serve, because we know that no matter how good the NHS is or aims to be, the issue of health and well-being for our population is a much broader issue that's a genuine sort of shared concern, shared effort. And we continue with that through our health and well-being strategy and our ICP work and so on. I shall stop there, Sue. Very happy to take any comments or feedback from colleagues. Any difficult questions, I'll invite Andrew to come in and save me.
Okay, thank you, John. Thanks for that explanation. Any questions at all? Julia.
Thank you. And I mean, it's a very, very concise and, as a non-NHS person, readily digestible report, which is really good, thank you. My only comment is, and I just, because it is so easy to understand it, I know, obviously I've been chairing the Right Care, Right Person board, where some of the issues around mental health have come out, and particularly, and I did say I wasn't going to raise this today, but it's just the fact that this is the planning ahead now, where there is this perceived, potential area that we need to look at around dealing with people in mental health crisis and support then and there, at the time. And I just wonder whether that is factored into any of those mental health bullet points that you've spoken about there, John, because I think that's the area, and there's been some really excellent work undertaken through the Right Care, Right Person sort of collaborative approach, but it is just that crisis point that I just wonder is that covered in those bullet points somewhere, if that comes out as something that we wanted to, do further work around.
It's a great question, Julia. I see these 32 as the specific targets that NHS England requires us to meet, to satisfy them. This isn't everything we do. It's a long, long, long way short of everything we do. I think, Andrew, the year before last, we had something like 160 targets to meet. And if I sit back and think about it, there'll be certainly far more than 160 that we're sort of required to do as we sort of go forward. So these are headline targets that NHS England have specified an expectation that we meet in terms of the return for the money, so to speak. This is really a bit of a proxy for everything else that we need to do. So please don't be concerned because Right Care, Right Person isn't specifically mentioned there, that there isn't that shared commitment to continue to work with you and colleagues to work our way through that one and get it right for the police service, for Lincolnshire and for the NHS as well. And indeed, there's a very, very long list of things that aren't on this list that are really, really important to us. So please don't, I know you're not, don't think that if it's not on this list, somehow it's excluded, because it absolutely is not. And I remember when we were looking at this in the board a few weeks ago, the list of things that really, really are important to us that aren't in these 32 is much longer than 32, and I'm able to trot so many off the top of my head. So this is for the particular planning purposes with NHS England. It's far short of the totality of everything that we're required to do. And we'll crack on together with you into the right care, right person. Thank you, Julia. Thank you. Sue?
Councillor Nanstead.
Thank you. Apologies if I'm looking down, but my laptop and your Wi-Fi have fallen out, so I'm having to look at my phone. I think that this is really useful. There's lots of green and not much red, which is always positive. I've got a few questions on it, but is there any stage a comparative data produced comparing different areas, the NHS? Because that would be useful to see how we're doing compared to elsewhere, particularly areas which are similar to Lincolnshire. And some of these, like improving A&E waiting times compared to 23/4 with a minimum of 78% seen within 4 hours. Now, if we're better than that, say we're 87% seen, we ought to know that and tell people. Because I'm sure on some of these that we're more than the minimum. I think that would be really good if we could get that sort of information, a bit more on the data. And there's some of these are fairly vague about improving things, but actually we're green because we've improved them, but we don't say how we've improved it. I do have a specific question at the bottom of page 44. There's mention of establishing and developing at least one woman's health hub in every ICB by December 24. The very last one on that page. Where are we with that?
Yep, very happy to answer those questions. First, in terms of comparative data with other areas, yes, yeah, absolutely. We see it all day, every day, don't we, Andrew? My understanding is that, as I said earlier, Andrew and I are signing off with colleagues the final Lincolnshire plan that goes into NHS England tomorrow. All ICBs are required to put a final submission in to NHS England tomorrow. So I'll work on the basis that will be all put in the sort of public domain at some point. In broad terms, my understanding is that many areas like Lincolnshire are striving to meet all of the operational targets. I haven't looked at any of the details. Some areas in some patches are a bit more challenging than others, but that's always the case. There's quite a bit of commentary sort of in the health sort of press at the moment about the relative sort of financial prospects for ICBs. Remember, there are 42 of us across the country, so we need to see how all of that sort of washes through. From my perspective, as I say, us being able to put a financial plan forward, which is a break-even financial plan, is something that we haven't done in Lincolnshire. Certainly in the 8 years I've been here, so that's good for us. And you may recall that last year the NHS in Lincolnshire came out of what's called National Oversight Framework Level 4, which is sort of equivalent to special measures. It goes 1 to 4. We're currently in level 3, but we're really quite ambitious to get to level 2, because I think that's what good normal should look like. And if we actually deliver our plan this year, I think we should feel confident that we'll be on the way to level 2. I think you make a good point in terms of the targets that are set, because some of these targets are really quite ambitious in terms of what the current level of performance is, because clearly the NHS is still working so hard to get on top of the backlog and the recovery that the pandemic caused. But we do reflect, Andrew, don't we, quite often things like the A&E target that's set is going to be quite a stretch for us this year, but it compares with a much higher target that was the norm a number of years ago. So I think there's a feeling that these targets nationally, if achieved, will be a stepping stone on to full recovery of the targets. And in terms of the Women's Health Hub, we have a Women's Health Champion sort of lead executive for the system. It's a lady called Claire Raybold as part of my team. We already have all of the services in that we're required to have as part of a Women's Health Hub. And in the autumn, we envisage having the first ever Women's Health Conference in Lincolnshire, which will enable all of the good work we're doing on women's health to be described and promoted, but also I think it'll be a really good sort of wider engagement opportunity to understand where we need to go further in terms of women's health. So again, that for me is another really important event for us. And just whilst I'm on a similar but separate subject, we do actually have the first NHS and Armed Forces Veterans Conference coming up in a couple of weeks' time. And again, that isn't something that's explicitly referenced in these objectives, but for us here in Lincolnshire, given we're a military county, given the very high proportion of military veterans who live in the county, making sure that we're able to meet the needs of veterans and their families is something that's really important to us. So again, a bit like the Women's Health Hub thing, we're doing some really great stuff, but we want to take stock of what we're doing and understand how we can sort of be even more ambitious going forward. I'll pause there. Andrew, is there anything you want to say in terms of some of these sort of A&E targets, please?
Is that okay, Chair? I mean, I suppose part of this is simple sentences in here cover a real multitude of actions and delivery, and trying to triangulate the sort of activity, the workforce and the money to hit these targets. So that the A&E one, for example, wrapped up in that, there'll be ambulance response times, there'll be long waits in A&E, there'll be the ambulance handover times, there'll be the flow through the hospitals and all the discharge work that collectively we're involved in. So really difficult to capture, I think, all of that. Can absolutely assure you there is so much comparative data out there that it's almost too much on occasion. And it also runs the risk that you end up comparing yourself with a bunch you don't want to mix with. If you suddenly think, well, everyone's scoring a particular score, so therefore it's okay. Well, actually, no, sometimes it's not okay. That should not be the bunch to compare yourself with. So I think John's right. This is an ambitious plan, but a huge amount of work gone into it. Not specifically to keep NHS England happy, because most of us don't get up in the morning to think that's my job to do. Our job is to make sure that the good people of Lincolnshire get a good service, that we can satisfy ourselves that our plans are robust, and in doing that can then ensure that our various regulators are satisfied. And to pick up the money bit, I mean, John says he's been in Lincolnshire 8 years. I've been in Lincolnshire 10 years this week, in fact. And when I moved from LCHS to ULHT, 4.5 years ago, I inherited a deficit of £90 million in ULHT. I'm not saying we've cleared all of that recurrently, but what I would say is, who would have thought you would see a sentence with the word Lincolnshire and break even in it? many national people still can't quite believe that we have submitted a plan on that basis. We have, it's a robust one, but it has risks in it. And John is absolutely right. That's the easy bit. All of the medals will get awarded if we deliver a plan that delivers these objectives and does so within the money that the government has given us. But we are in undoubtedly the best place we've ever been at this time of year. So I look forward in my retirement to watching this all get delivered. Thank you.
Thank you, Andrew. Heather.
Yeah, thank you. And lots to celebrate in this report. I think it would be really great if we could have a direction of travel next time, because for those who don't live and breathe it, I think it's a lot greener than last time, but I am dragging my memory back, and sometimes that comparison of that movement helps us to see it. I'm sure you'll expect me to raise the red around children and young people and perinatal mental health. I just wonder, I know we're doing work together through the Family Hubs programme around perinatal mental health. And you know, I'm concerned around how we really commit to developing that, because we need to see that provision really starting to uplift, not only for those with really complex perinatal mental health issues, but also with the lower levels. And also kind of interested in that missed target around children and young people accessing the transformed models of mental health care, but we've hit the target around not using inpatient for those with learning disabilities. And I'm pretty sure, although it's not a target here, we've hit the target for not using inpatients across that cohort. So it feels like we've shifted from inpatient out, but we haven't seen that pick up within the community-based. And I think we're aware of some of the pressures around that. But I wouldn't be doing my job if I didn't sit here and say perinatal mental health, children and young people's mental health. Can you assure me it will be a priority, that we'll be able to have some conversations about how we continue that work beyond the family hubs and make sure that those really vulnerable cohorts have provision moving forward.
Thank you, Heather. It's at this point I wish I had said to Pete, no, I want you to come and do the report, Pete, please. So just in terms of direction of travel, yeah, of course, the targets do change that NHS England set year on year, so it's not quite the same base, but broadly speaking, you're right. We're far greener than we've ever been. I used to work with somebody, if there was red on a chart like this, it'd be why is it red and not green? And then if it was green, it was, well, it must be too easy then if you can get there. So you never could win on that one. But our green is very, very hard won. I can assure you of that. In terms of children and young people, the commitment's absolute. I wish Sarah Connery was with us this afternoon, because I think that there's something in the way that the national NHS England team calculate what the target should be for Lincolnshire that I think, Di, we've got some problems with, haven't we? So the commitment is total, but of course the NHS England national machine has a certain formula that it uses in terms of setting out these specific requirements, and I think we feel quite strongly that whilst that might make sense across the whole of the country, there's some particular issues in our local setting here that mean it's a bit more challenging to work through. I don't know, Di, sorry, Sue, is that ringing a bell with you?
It is, and actually I was going to try and help out a bit here. So just in terms of the perinatal mental health to start, the way that target is set is what's causing us the problem, particularly because of falling birth rate at the moment in the county. So absolutely, it's not that we're not on it. It's just that, again, it's the way the target is set, because it's population based, that we don't have the number of births in order to almost be able to meet the target. So we're having to feed some of that back to the NHSE about how the target is set. in terms of the children and young people, we had a presentation last week within Lincolnshire Partnership Foundation Trust, and we've had repeated presentations at the ICB Service Delivery and Performance Committee about the whole piece of work around transformation of young people's services. That is a piece of work that is staged. It has 4 or 5 different stages to it, and the first stage was particularly around diagnostics and understanding the need more. So that work is ongoing. Again, we've got some issues about how the targets are set, but it absolutely is a priority, and I think we've been commended in some of the work that we've actually done about how we've understood the need, how we've co-produced the changes in service that are required going forward, and the programme of work that's sitting behind that. So it's being played out in a number of fora, both across the partnerships with the local authority, absolutely front and centre, represented through Charlotte Gray and our service lead in terms of specialist, but also in terms of the provider organisations as well. Hope that helps.
If I can, that's really helpful. So I'm really well sighted on all of that work, and I'm really impressed with the work that LPFT are doing. This is about, I guess, for me, making sure we've got that commitment to the funding of that work going forward. So for me, the perinatal mental health is a real priority, making sure we get that right beyond the family hubs and the investment that we've got and put in through the family hubs. And it's making sure that it's not to say that, I mean, at LPFT, I understand in terms of the rankings and in terms of the access have done exceptionally well. But it's about keeping it on the priority list. And we can talk about all the targets are judged like this. And I'm sure you're right, John. I'm sure you're right. For me, perinatal mental health is still something I can't rest on at the moment. I think that what we've got in place is good, but it's temporary. And also children and young people's mental health is a key priority for us going forward. And I understand that these targets might be about specific things. We need to keep those priorities up.
Thank you, Heather. Any other questions from anyone? Okay, thank you. Yes, Councillor Barbell.
Did you say microphone?
Just wanted to turn a microwave on.
I've got my microwave on. I'm cooking my tea. No, can I just ask though, because what Heather's been saying is quite right, but I suppose other people would say go to older people, they're important as well. Everybody is important, to be honest. But can we have regular reports back on that then? Because I agree with Heather, I get worried. And I know you've got lots of things to spend your money on, but we have as well. But it is about having that continuity of some sort of support for people, isn't it? And I'm not sure you always do that as well as we do. Sorry. Yeah, no, but we need to do it as well. But I want to be ensured, like Heather does, that this won't fall off the table. There's something more important comes up, and I often think, and I know you're not driven by government. We are as well, but we're a bit more flexible.
Yeah. It's in one of our 32 targets, isn't it? So NHS England have particularly highlighted that. I'd be very happy, Heather, to suggest that perhaps you and Sarah Connery sort of just get together with respective colleagues to sort of take stock of where we are, what the plan is, all of that in relation to it. Is a priority, you're spot on, and we are deeply committed to it. And then perhaps a joint paper might come back either to this fora or some other fora, just to hopefully sort of provide you with the assurance that you're looking for. Certainly, and all the conversations I've had with Sarah and other colleagues, I don't have any concern about this not being a priority matter for LPFT and for others across the NHS in Lincolnshire. And equally, all the sort of public engagement work that we do when it comes to this really highlights that this is a really important matter in terms of health and well-being of young people and families across the county as well. So I'm happy to sort of take that one away with Sarah, and we'll find a way just to sort of close that loop with you.
Okay, thank you. Any other questions? No? Okay. If we move to the actions required, we note the requirement for the NHS to develop an operational plan for 24-25, and that the expected delivery of key achievements against the planning guidance requirements. Is everybody happy to agree that? If you raise your hands, please. Any disagree? Any abstentions? No? Thank you. Okay, we now move on to item 10A, which is an update of our priorities, an assurance report. I've asked Alison if she would talk to the lead members or officers, and everyone is going to give 5 minutes. Thank you very much indeed for the information that sits within these reports. I think it's really helpful the way that it's been set out. And we will move through in the order that's given in front of me. I think it's the same as the order that's given in the paper. Yes, it is. Start with... Oh, Alison, are you going to say a few words first?
Well, I was just going to say, yes, this is a report on our previous Joint Health and Wellbeing Strategy, the one that was published in 2018, that ended in March of this year. So just to answer Malcolm's point about the delivery plans for this current year. So our new strategy was approved by the board in March, and the new strategy, along with the delivery plans for this year, are published on the Lincolnshire Health Observatory and Lincolnshire Health Intelligence Hub. So they are there to be viewed. So we have got those. So I say this update is the update on our previous strategy in the last year and the activities that we've done up until March of this year. So yes, I say the leads for each of the priorities are here to give a bit of an overview of that.
Okay, thank you for that, Alison. Okay, so the first one is the carers priority. Is there any more you would like to add, Anne-Marie? Oh, that's an easy one there then. Moving swiftly along, the dementia priority. Lucy.
Thank you, Chairman. So we were asked to highlight something that's going well and something that needs support within the assurance report. So dementia diagnosis is a really important part of the work that we do across Lincolnshire. For people with dementia, having a formal diagnosis acts as a gateway to care and support to live well. One of the things that has been going well locally, I think, is there's been a lot of work to improve our dementia diagnosis rate in Lincolnshire, and we've seen month-on-month increases in the rate of diagnosis over the past 12 months. Our rate of diagnosis is now 65.8%, which exceeds the levels of diagnosis before the COVID pandemic, and it's also higher than the national average. We're working hard towards achieving the current national target, which is 66.7%, so we're just about a percentage point beneath that, and we're aiming to reach that target by March next year. One of the really important things I think to recognise is that most of the drug innovations for dementia are all about early intervention. So the sooner that we can identify people and diagnose people with dementia, it means that we can hopefully get them access to those innovations and make sure that they're linked into the support that is available for them and for their carers as well. And linked to that, in the past year, we've also developed the Lincolnshire Dementia Strategy with priorities focused on increasing prevention, increasing awareness around prevention and how to support ageing well, around improving the experience of diagnosis for people with dementia, people living with dementia, and also around crisis support. The new dementia strategy includes a dashboard to measure the impact and success of the strategy, so we'll be able to measure our progress and improvements that we're making over time. One of the things that the strategy development work has identified is perhaps that we could do more around support for carers of people living with dementia, and this links to the item that we had earlier on in the meeting. So one of the things that we're really keen to explore as a group is services around things like sitting and befriending and respite support, so that we can make sure that our carers of people with dementia can be supported to look after their own health and well-being, to continue to care for their loved ones. So, thank you.
Thank you, Lucy. And one thing that I didn't say was we'll go through all of these reports. So if you have questions, can you save them until the end, and then we'll do all the questions in one go. So if I could now invite, I think it's Andy, isn't it, for the healthy weight priority. Thank you, Andy.
Thank you, Chair. So for the healthy weight priority, obviously people living at an unhealthy weight, overweight or obese, remains a significant challenge to Lincolnshire's health and care system. We still have sort of roughly 67% of adults in Lincolnshire are overweight or obese, and children, it's close to 40% of children in year 6 are overweight or obese, and now nearly 25% of children in reception. So significant problem, very much tied to the fabric of the way we live as a sort of Western society, and Lincolnshire tends to be a little bit worse than similar areas in the country, similar to the national average, if you like, but slightly worse across the piece. But this is a challenge for all areas of the country. It's a challenge for all areas of the Western world, to be honest, living the way we do, eating the food that we eat, having the lives that we lead. So what's really important for us in Lincolnshire is that we have the right approach with the right people working together to take that whole system approach to try and understand what the key points for intervention are that we can actually do something about, that is in our gift as a group of organisations working together, and that we do that intelligently, and we plan and work together to deliver that operational plan. That's work that we're doing through the Healthy Weight Partnership and the operational group that sits under that. We do have a delivery plan, which there's a link in the report. And just to highlight, as Lucy did, sort of one thing I'd say that's going well, I am really pleased with the way that our adults healthy weight service, the integrated lifestyle service, which also does smoking, some physical activity support and some alcohol support, is working and becoming a central part of actually the wider public sector, particularly including NHS systems and services in Lincolnshire. And we're hearing time and time again anecdotes of clinicians and other people saying, oh, we really use and value One New Lincolnshire. And some of the figures that we're getting through, and you can see some of the reports in the numbers in your paper there, this is a service that is working. And one of my other areas, as people may know, is sort of trying to champion the agendas around health inequalities, trying to reduce some of these differences. One New Lincolnshire is a service that we can point to that is having a positive effect in health inequalities. We always want to do more. And so obviously we'll be working to recommission the integrated lifestyle service through next year, and would value everybody's support and engagement with that process. There has already been engagement underway. And I suppose as part of that, what I'd say in terms of what we're working towards, what we want to do more work on, is just to make sure that we have that proper overview of all the different health services that are available to people who maybe want to lose a bit of weight. That's right from the primary prevention side, linking into the physical activity agenda, which Emma will update on, but right through to the hospital services, sort of tier 3, tier 4, for people who need sort of maybe even a surgical intervention. And we will be doing that work. I think there's some opportunities in terms of how we work with primary care and other organisations to make sense of that pathway. I know that the NHS digital weight management is something we're perhaps not using as much as we could. There'll be opportunities around recommissioning health checks, which is something else that we'll be doing, and potentially looking at some innovative delivery. So there's more work to do, I think, to make this a seamless offer for Lincolnshire in terms of the services. And just as I finish, I'm also really pleased to say that our piloted child and family weight management offer, so the children's and families element of that integrated lifestyle service delivery, the results that we're getting back through are starting to show that a majority of children that go through that service are reducing their weight, which is really good to see, and it proves that we'll be continuing to work and tweak that model, but it does seem that the basic shape of that is effective. So yeah, lots to celebrate, loads more to do. Thank you.
Thank you, Andy. Housing and health. I think, Anne-Marie, you've got a shot at this.
Thank you, Chair. So this summary really relates to the Housing, Health and Ageing Well Delivery Group delivery plan and progress against that, and that group, which is chaired by Councillor Bowkett and Councillor Gray as co-chairs. So the aim of the group is to put in interventions and ensure that people are able to live independently, they can stay connected, and have greater choice in where and how they live. There's been some significant progress this year against the delivery plan, and just to highlight some of those key actions that have come forward. So as a county with partners and districts, we now have a county-wide discretionary housing assistance policy that 6 of the 7 districts so far are now signed up to. The benefit of that is offering a consistent approach to the delivery of disabled facility grants, which is part of the Better Care Fund, and we'll see hopefully greater equity across the county in how those are delivered. We've also seen build of an online resource through the Connect to Support platform as part of a Good Homes Hub. That's now been completed and due to go live very soon, which will include an interactive assessment. That's to help individuals identify issues and link into advice themselves. And a follow-on from that is a pilot for those that are unable or find it difficult to do that, so that they can receive additional assistance. So that was first of the pilots. We also have a pilot that's come forward through funding from the Department of Energy Security and Net Zero. That's for local energy advice demonstrators, and we have 2 of those running in the county now. That's to support hard-to-reach households living in hard-to-treat homes, to improve the energy efficiency of their homes in a sustainable way. And the 3rd pilot that we've now got coming forward is to do with hoarding and supporting individuals in the East Coast Skegness area. Part of that is to understand what would be required to successfully support people who hoard to get through that process and receive the broader support that they need from all agencies. In terms of what would be helpful, other work, I think, is for partners to encourage and recognise those pilots and help us to make a success of those. They do all have evaluations associated with them, so we'd like to be in a position where we can establish if they are something that would warrant taking forward. And also during this year, we incorporated the Ageing Well agenda into this area of work. So we're developing a delivery plan that specifically relates to that, which all partners in the Housing, Health and Ageing Well Delivery Group are signed up to. And we'd like to promote that to the Health and Wellbeing Board and wider partners as to how we can ensure that we are meeting needs of our older population within this area now as well. Thank you.
Thank you, Anne-Marie. We move on to the mental health and emotional well-being for children and young people, and I think that's you, Kevin.
Thank you, Chair. So the board will be aware that post-pandemic we saw a significant increase in Lincolnshire in referrals for mental health support for children and young people. Both demand and the waiting times peaked around spring 2022. Since then, we have seen a reduction in referrals to more manageable levels, still higher than pre-pandemic, and there's a great deal of work that's been undertaken to achieve a reduction in Lincolnshire's waiting time since then. In terms of performance against the national 4-week wait target, Lincolnshire's at the top with 85.2% of young people being seen for assessment or support within 4 weeks. Just in comparison, the regional and national average both around 64%. For that. So those young people waiting more than 12 weeks, we've been focusing on particularly for specialist treatment from CAMHS. That's reduced significantly, and we're on target to have no young people waiting more than 12 weeks of specialist treatment by March 2025. And all young people and their families waiting for treatment now receive check-in calls and support from family health workers while they're on that waiting list as well. As I think has already been mentioned, we've got an extensive programme currently ongoing to review and transform children and young people's mental health support in Lincolnshire. We've completed the review and gap analysis phases, and we've determined the priorities for our transformation, which are outlined in the report. We're currently in the process of modelling those services against the priorities before we start working those up into more detail to look at the implications and requirements for decision making from December 2024. Our mental health support teams in Lincolnshire are performing very well. We have the highest level of activity across the Midlands region, and we have a visit actually planned from NHS England in July with the Boston mental health support team to discuss and help NHS England understand our success in Lincolnshire, in particular that team. We do have 7 teams now live across the county, and a further 2, one going live next year, January 2025, and a further one in January 2026. So progressing well with those. I've just picked out some of the other achievements in the report. So just to highlight the success, as we've already mentioned in the NHS planning report around keeping children and young people with learning disability or autism out of specialist mental health inpatient. We reduced down to 0 inpatients by, I think, October last year, and we've only had 1 short-term informal admission since then. We've actually kind of since the CYP Key Working Service came on board in April last year, they've helped avoid over 25 admissions of children and young people and supported over 66 children and young people. The therapeutic model of support that we have in our new children's homes was praised by Ofsted in their inspection. We've continued successfully supporting young people through the complex needs service as part of that model as well. We've got 2 pilot children and young people's mental health practitioners working within GP surgeries. That's in the IMP and the Boston primary care networks. So bringing more of that join up from primary care to our secondary care. And then a couple of achievements in our crisis service. We now have 24/7 mental health liaison support for young people available in the north and south of the county. They're based in the hospitals but provide outreach to our urgent treatment centres. And we also, the Mental Health Urgent Assessment Centre at Lincoln Hospital is now all age, supporting children who would have otherwise gone through accident and emergency. So in terms of what that means, I think I echo Heather's points from previous discussion that while we've had kind of recent investment, we do know that children and young people were disproportionately affected by the pandemic for a lot of services, but including mental health. The work that we're doing for the transformation will require further shared commitment to support around that joint working and integration, and more importantly funding to continue the growth and support more children and young people. Thank you.
Thank you, Kevin. And finally, Emma.
Thank you very much, Chair. So I'm just going to update briefly on the physical activity work. And I guess in sort of headline terms, I just wanted to say what's been really positive, I think, is the evolving connections at both system level across partners strategically and also at kind of grassroots and in the place level in terms of organisations and people coming together. We have a task force that's chaired by Ian Fitch, so of course in a few months' time we might have to be rethinking that. But again, a really strong commitment from partners across the system there to talk together about how we can tackle the challenge of inactivity. Within that, there's an absolute commitment to tackling inequalities and to supporting those people and places where we see higher levels of inactivity. But you know, despite the efforts, inactivity levels in Lincolnshire do remain significantly high. We're all working to understand how we can better kind of create a narrative around the positive impact on the health and care system if we're able to think about not even just health prevention but actually health creation and enabling people to live more active lives from the earliest opportunities. And within that, I just thought it was interesting to highlight an example briefly around the pre- and postnatal pathway work, where we work really closely with Better Births Lincolnshire, and every single part of that pathway has considered how physical activity can be embedded, from training the medical clinicians, practitioners and the midwives, providing them with the right information, providing the people within that pathway with the right information and communication about how to be active when you're pregnant and post post having a baby, and then our work in supporting the physical activity sector to provide a better, greater quality offer for pre and postnatal mums. So there's a really good example there of how we can roll physical activity out into many pathways across the health and care system. And I think all of this is about creating a relevant, resilient physical activity offer so that people can access something that's kind of on their doorstep that they want to do when they want to do it. And it really supports the integrated lifestyle service, which is quite a bespoke part of the product that reaches those people of greatest need, and how can we provide that kind of wraparound offer that meets the needs of the wider population. I think we're getting better in understanding people's lived experiences, working with people that face barriers to really understand what those barriers are and how we can help tackle them together. We are getting better at working in communities and really getting to know those local champions and understanding what works for them and what they need. And I think there's some real innovation in connecting health and the physical activity sector. So an example of that is at North Hykeham 1NK, which has been a traditional leisure centre for many years, is now operating as a health hub, and many referrals are coming through cardiac and cancer, for example, into that space. And what we're learning is that those people coming in are not presenting only with an opportunity and a need to be more physically active, but also the mental health challenges and our physical activity workforce need to be better trained to a higher level. And actually we need more people in the workforce that have got the right level of coaching qualifications to be able to deal with people that are coming through the healthcare service. So lots of opportunities for growth, but I think we're building on, you know, some really strong work here and some really strong foundations, and lots of people in the room and beyond and their colleagues are really kind of helping, I think, you know, create a shift. Partners are wanting to see us, they want us to be bold, they want us to do things differently, they want to understand that interplay between the systems and what's happening at grassroots level. They're committed, they're passionate, and this is about people ultimately at the end of the day. And I think when we can find those people that care, that are passionate, that's when we really start to see a step change. Thank you.
Thank you, Emma. And finally, sorry about this, Lucy.
Thank you. Yeah, just an update on the adult mental health area. So significant amount of work across the prevention, early intervention and treatment space for adult mental health is illustrated in the report. Over the past few years, we have seen an increasing number of adults needing support with their mental health, much the same way that we have for children and young people. But alongside that, there have been a number of local developments to strengthen the mental health support that's available across our kind of primary and community services and also within specialist services through RPFT. One of the things that's been going well, I think, to highlight is the Community Mental Health Transformation Programme, and particularly the work that's been going on around investment in the voluntary community, faith and social enterprise sector. That's increasing access to provision to support across our communities in a number of settings, things like wellbeing hubs and nightlife cafes. Over the past year, the Mental Health and Wellbeing Community Investment Fund has supported a wide range of groups across our communities to develop and enhance support that is available to meet the needs of local communities. And additionally, there have been a number of strength-based assets, things like our wellbeing hubs, that seem to be going from strength to strength and developing. And that focus on the VCFSE sector, I think, has been increasing the support that's available within our communities on the ground around prevention and early intervention, as well as treatment and recovery from mental illness and supporting people as they kind of go through their treatment journey. Something that is highlighted within the report as an area that we continue to work on is the work that we're doing around suicide prevention. The rate of suicide in Lincolnshire does remain high compared to national average. And there are a range of complex, often structural factors which influence suicide. One of the things we are really aware of is that it drives health inequalities. And so, for example, we see rates of suicide are much higher amongst adults with complex needs around substance misuse. So we've got some real vulnerable groups of adults within our communities that we're working closely with in that suicide prevention space. One of the things we do know, and as it's highlighted in the report, we've released a new Lincolnshire suicide prevention strategy this year, and within there it talks about the importance of increasing awareness of how to talk about suicide across our communities, tackling stigma so that people can come forward for support if they are feeling suicidal themselves, or if they've been bereaved by suicide. It's really important that they can talk about it with friends and family and in their communities. And so making sure alongside that people are aware of the support that is available across Lincolnshire. About 18 months ago, a specialist suicide bereavement service was commissioned that's delivered by Amparo, and that service is going from strength to strength in terms of the number of people who it's supporting directly within our communities. So that's a really important step forward. But we do need to continue our work to raise awareness about the support that is available. One of the things that we're really keen to make people aware of is that there's really good free quality training available through an organisation called the Zero Suicide Alliance that supports people to kind of spot signs of suicide, to know how to have conversations about suicide and how to signpost people to support. So that's something that we're really encouraging everybody across our community to take part in. And one of the good things is they've developed specialist training as well. So for example, they've recently released some training for people around autism and suicide as well, which is another one of those really important risk factors that we know about. And then just finally, we are hosting a Lincolnshire Suicide Prevention Conference in September aligned to World Suicide Prevention Day.
Thank you, Lucy, and thank you to all of you. Much appreciated. Are there any comments or questions from anyone? Councillor Bowkett.
Well, you knew I couldn't keep quiet on this one. Well, thank you for all of you for your presentations, because they're all close to my heart, really. For Emma, I think the voluntary sector and the exercise and everything else really fits in with everybody, doesn't it? With Andy, with his children's work. Certainly living where I do in Wainfleet, we're a very deprived area that we need to encourage exercise. So the voluntary sector and what Emma does is really vital to us on the coast. Kevin's work in the children's mental health, I mean, you know, we are making some strides. We've got a long way to go still, but we are making strides along with Lucy and the adult mental health and the suicide prevention that I'm chairing and hosting and everything else that we're doing with the conference. Anne-Marie's health, housing and ageing well that I chair. I think we're doing very, very good work there. We've got the districts behind us, we've got health, we've got police, we've got the fire service, we've got the ambulance. The extra care facilities that we're building this year with our districts are fantastic. We opened 2 years ago the Derwent with Lincoln City. We're opening another in Welton, and a further one we're building in Sleaford, which have the 10 or 12 apartments we're doing for the working age adults, which is a first for us in Sleaford, which is going to be fantastic. But they are going to be a fantastic facility. But back to dementia, which is Lucy, which is a real big one for me today. I can't welcome this enough. To have help when people have got really bad dementia. It's really good. Thank you.
Thank you. Councillor Nunstead.
Thank you. Just a couple of points on the Healthy Weight Partnership. The one year Lincolnshire work at Birchwood was really good, and there were people queuing out the door, which totally took them by surprise, which is why one of the sessions starts in January, I think, because the capacity wasn't there to deal with all the people that turned up. So that was really good. Just a question on children and school meals. What can be done to improve the healthiness of school meals? Because my understanding is most of the secondary schools certainly do not meet the statutory guidelines for healthiness.
Thanks for that, Andy. So I think it's a really fair challenge. So there is a very strict criteria around the school meals that can be served in both primary and in secondary schools. I think what happens very often in secondary schools is that is offered, and then snacks are offered as well. And very often children will choose to purchase from the snacks repeatedly rather than from the healthy meal option. In terms of what we can do about it as a health and wellbeing board, or what any of us as individual agencies can do about it, it's nationally governed. So it's nationally set and it's nationally governed, and the funding for schools is set nationally as well. So I think all we can do about it is continue to raise awareness and to consider whether there's something we want to do about writing to the Department for Education to highlight it to them. In terms of the control we have over our secondary schools to influence their provision, it's not particularly significant. Having said that, we have got a healthy food in schools team, and they do lots of work. They have lots of different programs that they do to support schools to think about how they can make those healthier options more appealing to children, reduce the use of the snacks. We have systems through which we can check their menus and support them to implement that. I think it's fair to say they're more heavily used within the primary sector still. And still the primary sector work more heavily with us on that. But it's something that we are promoting, and we have done some work to provide some additional capacity to work through the secondary schools this year, I believe.
I think you're absolutely right, Heather. I think the other problem is, of course, so many of the schools are academies now. So once upon a time, we used to be able to be all over them, didn't we? But now the influence isn't quite as strong as we would perhaps like it. But having said that, one thing that I would like to applaud is I think it was the summer holidays last year, there's an ongoing programme, the Holidays Activity Fund, isn't it, HAF, and that's specifically for young people who are in receipt of free school meals, isn't it? And I was staggered by the quality of food that they were offered at lunchtime. It was really, really nice. And there wasn't anything like a pizza or whatever in sight. It was genuinely not quite meat and two veg, but along the lines of what most of us of a certain age would consider a good square meal. But the children, it was really noticeable. They were really tucking into it. They were really enjoying it. And also the concentration afterwards. That's the bit that really stuck, that they not only did they enjoy their food, but they were then ready to do lots of other stuff as well. So there are things that we can do to support and promote, but I'd like to do more, without doubt. Dean.
Thank you. Firstly, say a really sort of comprehensive overview. I think in relation to sort of mental health, we talked about sort of adults and children in two sort of separate areas. And one of the things the challenges that we hear through Health Watch is that transition between children and young people's services and then mental health is exactly that, is a challenge. So I just wanted to make sure and sort of be reassured that that's sort of is being picked up through one of these kind of work streams.
Who would like to pick that one up? Thank you, Lucy.
Yeah, thanks, Dean. It's a really important point, and we do talk a lot within children's and adults' mental health about that, the importance of the transition into adult services and getting that transition right. One of the things under the new health and wellbeing strategies, you'll see it is all age focus around mental health, and partly that is in recognition of the importance of that transition. So conversations are absolutely ongoing. Yeah.
Thank you. Any further questions at all? Oh, John.
I just thought these were great reports, actually really, really helpful, succinct, clear, and just thank you to everybody for the hard work in putting them together. I think it's probably one of those where it's easy to write a lot. Actually writing a highlight which got all the salient information in is quite a skill, so thank you.
Okay, if we move to the actions required, we're asked to note and comment on, which we have done, as far as the annual assurance reports are concerned. Do we have to put our hands up?
We're just going to note the appendices A to G.
So would you like to note them with your hands?
Yes, please.
Okay. Any against? Any abstentions? Nope. Okay, thank you. We move now on to agenda item 10, which is just the action log of the previous decisions, which is not for commenting on, unless somebody's desperate to do so. And then we look to the, yes, it is the final item, which is the forward plan. Can I just say to you all, as I usually do, if there's anything that you would like putting on the forward plan or you feel should go on the forward plan, can you make sure that one of us knows, be that Rachel or Alison or indeed myself? Before I close the meeting, there's another person that's going to retire and leave us. Thank you, Andrew, for being here. You were absolutely right about that £90 million deficit that you inherited. And you also inherited a lot of comments and grumpiness and whatever else, that it couldn't be done and it couldn't be touched and this, that and the other. You have done an absolutely amazing job at ULHT. I hope you leave here with a sense of pride, because you jolly well ought to. You've really helped put the system, the ICS system, being part of the system, on the map. And when John said about us, it's NOF, isn't it? NOF, moving from 4 to not just 3, but actually expecting, not hoping, but expecting to move to 2. You have played a huge part in that. And I really, really do thank you. And I hope you have a wonderful retirement and a lot less stressful retirement than you may have had in your working life. Thank you very much indeed. And on that note, I will close the meeting. Thank you.